Welcome to Beyond the Press Release, a production of Agoracom, in which we take the time to speak with small cap executives about what's going on at their companies. With us today, happy to have him back, Tim Daniels. He's executive chairman at AIML Innovations, trades on the CSE on the stock symbol AIML, and for our friends in the US, FIRZF. For those of you new to the story, that's going to be a lot of you. As the name implies, AI, artificial intelligence, ML, machine learning. That's what the company's focused on, specifically on the digital healthcare space, more than just lip service. Because, guys, we know a lot of people out there like to use the buzzwords of artificial intelligence just as a buzzword. But in this case, all right, AIML successfully displayed its proof of concept deployment in a study funded by the Bill and Melinda Gates Foundation, which further validated their technology. Its key subsidiary, HealthGauge, is a bespoke, that means customized, personal health monitoring and management system. It combines the latest wearable health monitors and leverages the power of AI and machine learning. But don't think about this company as a wearable company. It's way beyond wearables. And essentially, at the end of the day, through artificial intelligence and machine learning, it provides ongoing health management, access to health coaching, real-time data capture, way beyond anything you'd find on a regular wearable. What does that do? Fast feedback, resulting in better outcomes, which means we live either longer or we live better. And let's not forget, for society, it reduces a lot of the stresses on our healthcare system, including financial and overburdened infrastructures. They recently closed a $3 million financing, so they've got the backing. Tim, welcome back.
It's good to be back, George. Thanks for having me.
Hey, so let's talk. I want to go a little bit some of the things that have happened to the company, especially these great partnerships. But there's still a lot of people new. This isn't your regular Samsung wearable kind of company. You're not just a hardware company. For viewers that are new to AIML, what is that you guys do at a 30,000 foot level?
Okay. We are the complete end-to-end digital health solution provider. We do have hardware, but hardware is just the tip of the iceberg. Right. Companies like Google and Apple and so on will try to tell you that that is the be all and end all, but that's only the beginning of the story. Yes, we do have our version of a wearable, and this is as good as any of the wearables out there on the market today. This wearable will give you your blood pressure, your heart rate variability, ECG, PPG, and on and on and on. But what makes this so powerful is that this wearable is coupled with our apps that are both Android and Apple usable, but more importantly, with our cloud-based platform, and that platform is AI powered, and it gives immediate actionable feedback, not only to you, but to your entire healthcare food chain or watering hole. So you plus your doctor, your other healthcare providers, your nurses, your therapists, your pharmacists, and your family members who need access to it. Anybody and everyone who needs to be a part of your health wellness food chain has access to this immediate and actionable data. And so it's a complete end-to-end solution.
Yeah, my biggest complaint with wearables, and that's why you guys I want to make sure everybody at home knows, beyond wearables. But my biggest complaint is, okay, it gives me interesting data right on my wrist, but I really don't know what that means beyond the basics. Exactly. Like, I know if my heart rate's over certain, but for 99% of us, like, okay, what does any of this mean? You're turning that into actionable information that can be accessed by my doctor, that can be accessed by my family. And by the way, I didn't want you to just show off yours. All right. Can't let you show off. You're not the only guy. Right. And for everyone at home, take a look at the back of that right there, right? I mean, look at those sensors that are there. So this is going way beyond the wearable. So what is your target market? Because I want to make sure people understand that you're not just selling these to George and it's you're not selling them one-offs, even though you have an e-commerce site.
Yes.
What's the business plan that you guys have got? Because I love this.
Yeah, absolutely. Our primary business model is B2B through channel partners. So our focus is dealing with insurance companies, hospitals, other healthcare providers, accountable care organizations, and large corporations. So organizations that are looking to provide either their customer base or their employees with better health plans, predictive health plans, the ability to have immediate feedback prior to serious health issues coming up, or chronic patient monitoring. So somebody who is under regular doctor care for maybe it's diabetes, maybe it's weight management, pain management, pregnant women, and so on and so forth.
Cardiovascular,
But
cardio, your
yeah,
health,
exactly. Yeah, heart
your heart. I
disease,
mean,
and so on. So anyone who has regular need to interact with their doctors, this is giving them and their entire health organization behind them, meaning their doctors and caregivers and nurses and therapists and pharmacists, access to the data that those people need. And
so
the data is,
when you do a deal, Tim, you're
yeah,
doing with potentially a few hundred to tens of thousands at one time, because you're trying to
correct,
strike a partnership with George Com Insurance. George Com Insurance says, "Hey, I've got high risk insurance clients that I'd like to make sure stay. Look, as an insurance company, the longer my clients stay alive, the more money I make at the end of the day. So I've got people in high risk. I've got people who are just older in general." And that makes my business that much better, because I'm not waiting for George to drop. I actually know in advance that, hey, George may be having a cardiovascular event here based on the AI coming out of AIML.
Right. So you hit on one, and that's helping to keep people alive, but it's also to be preventative. To help allay situations before the event happens. Much cheaper to treat, let's say, heart disease before the heart attack than after the heart attack. And that's not only for insurance companies, whether it's life insurance companies, health insurance companies, but also employers. Far cheaper, far more cost effective to keep your employees healthy and on the job than to pay for their sick leave after the fact. And so any way that they can get a leg up in terms of some predictive analytics that helps to mitigate an event before it happens is money well spent, and that's what we're able to do.
And by the way, there's got to be another benefit there, which is, if I'm looking for a job and I can either go to ABC Widgets, XY Technologies, and ABC Widget says, "Hey, George, as part of your healthcare package here, you have the option to be enrolled in our program, and we're going to just make your life a whole lot better with this preventative, predictive technology." That I'm going to say, wow, that's a great perk. At the end of the day, you're not going to be able to pay me $1 million a year, but if you give me a great perk that gives me a healthier life, I've got to figure that's another compelling business advantage for companies that team up with you.
You bet. Absolutely.
Now, more than just lip service, look, there are a lot of people who, like I said at the beginning of this, will use artificial intelligence, machine learning, wearables, telemedicine. Everyone's trying to capitalize on those as buzzwords. You've got the third-party validation of the potential power of your technology. We talked about it last time, but it's worth noting again. You had a study using your technology that was funded by the Bill and Melinda Gates Foundation. So talk to us a little bit about that and what came out of that.
Sure. So the overview of that is we conducted a study, which, by the way, was unsolicited. The folks came to us saying, "We've heard of your technology. We are looking for an exclusive technology partner to help us try to mitigate risks in high-risk pregnant women in third world environments, in third world country environments. And so the purpose of the study was following a group of pregnant women who were at risk for eclampsia, or in other words, hypertension, high blood pressure.
Right.
And that is a major health risk to pregnant women throughout the world, and one of the leading causes of death, both for the pregnant woman and the unborn child. And so any sort of actionable information that can help mitigate the problems before it becomes, a serious health risk is worth understanding and studying.
Sure.
And that was the point of the study. And essential to the study was a technology that could be easily and readily retrofit into the existing workflow, meaning we had the ability to immediately fit in with the patient load and the traveling nurses who are visiting these patients in villages where there was no technology. In a lot of cases, there wasn't internet or even cell phone signals. And using our technology, what they were able to do is aggregate the data. And when the visiting nurse would come around on their weekly visit, that nurse could download that data and take it back with her and upload it into the cloud. And so we're very pleased with the outcome of the study, in that it not only validated our technology, but showed that it was readily malleable to existing conditions and workflows, regardless of how inhospitable those work conditions were, and it worked admirably, and was absolutely a validation of our technology. And it also showed that that what we have is reconfigurable to many different maladies. Okay, in this case, it was women with high blood pressure. It could have been a study with men with heart disease or people with pain management. It doesn't matter.
You're agnostic.
Because, yeah, exactly. Because this is reconfigurable, to so many different situations. So it was it was a terrific, proof of and validation of our, proof of business model and proof of technology.
Hell, with the Euro soccer tournament coming up this summer, you can monitor a bunch of Italian soccer dads for their blood pressure and predict, hey, calm down, you're gonna have a heart attack, right? But
exactly, yeah. I don't know. We might blow up a few machines.
Oh, you can say that again. So let's talk specific business now. You've partnered.
Sure.
So you're aiming, like most people, you're aiming to access the US market, and
Yes.
you partnered with 3 companies: Medical, MedStack, and Privacy Horizon. Give us a little bit about each partnership, why they are important in terms of how you break through into the US market.
Okay, and so they each fulfill, different necessary roles for a company like ours going forward. First, with Medical, they are a company who specialize. First of all, they're a U.S. FDA certified agent, and in that role, what they do is they take technologies like ours and put it through its paces and file all the paperwork on our behalf for FDA approvals for the technology. But not only in the U.S. market, Medical does the same thing in the EU market. Okay. And throughout most of Asia, at least all the primary markets in Asia, and into South America as well, with the big markets such as Colombia and Brazil and so on. They're a really important partner for us, in that they're the ones who walk us through the validation steps to get us approved. So we're in that process now with them.
Then there's MedStack, and then Privacy Horizon.
Yeah, and so both MedStack and Privacy Horizons are both companies that specialize in compliancy with privacy and security matters.
Okay.
Because when it comes to dealing with individuals' health statistics and vitals.
Yeah, you're transferring my
there-
health data to different people, so you want to make sure
right,
that it
exactly,
only
and
gets to
so
those people, not to anybody else.
exactly, and so there's nothing more critical than ensuring that that data is properly protected, and that only those who are supposed to have access to that data have access to that data, and no one else. And so again, companies like ours, can try to go it alone, or we can partner with companies that do nothing but this sort of task on our behalf, and give you the seal of approval. So in our case, we believe that that's working smart instead of working hard.
And that dovetails perfectly into the fact that your business plan is to partner with large enterprise, large organizations.
Exactly.
Before you get to them, one of the first things they're going to ask you is, hey, how are you protecting George's privacy? How are you protecting George's data?
Yeah.
So you got to so let's talk about pilots now. Give us the profile of the kind of companies you're looking potentially piloting with, and what does 2021 look for in terms of the pipeline for pilots? Because
Sure.
obviously as shareholders, that's where you want to get everyone to.
Sure, absolutely. We've got a number of different pilots that are pending now, and we should, over the course of just the next few short weeks, start to roll out some of the announcements on some of those pilots.
Okay.
Our typical partner on these pilots are insurance companies, government agencies that are the health payers, private companies, Fortune 500 companies, and others that are looking to provide healthcare solutions to their employees. I mean, it's interesting when you look at companies like Starbucks, for example, a great example. They spend more on healthcare for their employees than they spend on buying coffee for the paying.
That's why they got such a great workforce, such a great company, such a great brand.
Exactly. Yeah, exactly. And so companies like that are very, very interested and concerned towards the well-being of their employee base. And so these are the sorts of organizations that you'll be hearing some announcements from us in the upcoming weeks in terms of. First step is doing pilot projects with them. They like to roll it out in small batches in one territory, maybe over a few dozen to a few hundred to maybe a few thousand test cases to see how it works. And if they're happy with how that goes, then you look towards a larger step out towards the many thousands or tens of thousands of customers or employees within their systems.
And Tim, we want to make sure shareholders at home understand that the great thing about going after big potential pilots, turning into big potential customers, is that's obviously a very, very lucrative. But everyone should understand that when you hunt for big game, it takes a little while longer, right?
Exactly.
You could open up a Shopify store tomorrow, do some Facebook marketing, sell a bunch of these to a couple hundred people. Great. But if you want but are you happy with the progress so far, the interest that you're getting from potential pilots, and how they're moving along within their structures?
Yes, we are, and again, they never come together, fast enough, or enough of them coming together at once. But we are, aware of the process. These are large bureaucratic organizations, and organizations that have to be, extremely careful and cautious with respect to products that they're rolling out to their customer base or their employee base and so on. And so they're going to make sure they don't make any missteps. So we are going through those protocols with them, and we are happy with how that's going. In some cases, they are discussions that we've initiated, companies that we've approached, who have kind of sat back and said, hey, that's exactly what we've been looking for. In other cases, they've come at us unsolicited. Some very large corporations who have been looking around for a solution like ours. And one day our phone rang and they said, we're looking for a solution. Your name came up continuously. So here we are, let's talk. And so that's nice validation to see as well, that the right folks in the right places are starting to take notice of our technology and who we are, and starting to call us up. And again, these are major.
And you're just getting started. I mean, all fairness, other than the Gates Foundation kind of release, it's not as if you got a ton of press out there yet. And
we're new out of the gate. We went public first week in January, so we're still in our first quarter of existence as a public company. HealthGauge existed as a private company prior to that, but we took them over just prior to the end of the year and rolled it out in the first quarter of this year. So we are a brand new company. The other, while the B2B model is definitely our sweet spot, and I don't want anybody to lose focus of that, but we did hit a bit of a milestone here just in the last week or so, where we did launch our e-commerce platform, and that was nice because I mean, up until then, we were strictly an R&D company, so all the money was flowing, one direction, which was out the door. And so nice to see for the first time that some of the money's starting to come back the other way, and that's a nice thing. And a bit of good news that the first batch of these units that we got in, they sold immediately. And so I encourage your viewers to go to our site, www.healthgauge.com, click on products, and unfortunately at this moment you're going to see a message saying that we're back on back order. We are expecting
as a shareholder, that's a good sign to see.
It is a good sign. That's a good sign to see. We are expecting more units to come in imminently, probably within the week now. And so the retail side of it, the demand has been greater than what we were expecting. And so that's great. It's a revenue stream unto itself that we consider to be, strictly a bonus, but it is there, and it is starting to generate some numbers for us already. But again, we're not taking our eye off the ball, which is that B2B market. And at the end of the day, we are agnostic towards the hardware and other. But before this year is out, your viewers will be able to link their Apple Watch or Samsung Watch or Fitbit or whatever it is that they've got on their wrist, to our platform and use us through their own hardware. So the hardware is really not our primary focus.
Yeah, you got to have it, but that's not the primary. Yeah. And I love that. Exactly. I think that's great. Last question for you. Just give us an idea of what your business model looks like. So if you end up doing a pilot with GeorgeCom, GeorgeCom Enterprise, and I've got 5,000 employees. Let me use 1,000 because I don't want to use a big number so people don't think we're. But I've got, what is your business? What does the model look like? So I say, Tim, this is great. I want all my employees to have this, or patients, or whatever the case may be.
Yeah.
What does the business model look like at that point?
Sure. So again, it's the a SaaS model, meaning software as a service platform, and it's on a subscription basis. And so on commercial level, we're talking $25 per month per user, and those numbers aggregate. This is the magic of compounding. So rather than at the beginning of each new month, our numbers don't reset to zero like on the retail side, where we sold 10,000 watches last month. What are we selling this month? It's the business compounds, meaning as companies ramp up their user base, our monthly revenue grows, month over month over month on a compound basis. And so that's,
And this
the beauty of
$25
that.
a month include the hardware. So if I say, hey, Tim, I want all 1,000 of Gorcom employees to have these watches, or is there separate, okay, one time $150 for the hardware and then
Right.
$25 a month thereafter forever
Right.
for the SaaS?
Right. So yeah, on the commercial level, and again, these are, we are in discussion, negotiation with different users, and so there'll be slightly different fee structures depending on the entity and
Sure, of course.
the size of it and so on. But as a general rule, we'll be looking at about $150 for the hardware, followed by about $25 per month on average on subscription for each user coming in.
And that sounds, look, devil's advocate, that sounds kind of pricey from the from the B2C side, right?
Yeah.
But there is a market for it. Don't get me wrong. There are a lot of people out there who say $25 a month to have predictive, proactive monitoring of my health, done, right? But so, on the business side, though, there are a lot of companies who say, hey, that's worth it to me. If it costs me $25 a month to make each of my employees and critical staff happy, they feel part of the family, I'm taking care of them, that's a small price to pay for them to be happy. Just like Starbucks, right? They spend a lot more, and they have the best staff in the world.
And on the B2C side, we've actually got 3 levels of plans. The first is you buy this hardware, and along with it comes the Android or Apple phone software that's free. That's included, and that gives you immediate and actionable information. And for most people, that would probably be adequate enough. If you're somebody who has some chronic needs and you want to involve your medical team, your doctors, your pharmacists, your therapists, and so on, there's a second level of plan called the Thrive plan. And again, this is the B2C model, and that's only $5 a month. And that includes our cloud-based platform. And so basically, a retail user for only $5 a month will have access to most everything that they need. There is the blue chip plan for $25 a month, or $210 a year, 210 Canadian dollars a year, called the MyViva plan. And this is for people who want the all-inclusive plan that not only includes all of our automated tools, but for those who have that added need or incentive to relate to live people on the other side of the screen. And that plan, includes personal health advisor through video conferencing, customized meal plans, fitness and yoga plans, daily meditation and reflection, diabetes and other chronic illness plans, and even mental health resources. And all that's included for $210 a year or $25 a month. So on the B2C side, we do have the 3 level of plans that will fit any user's needs.
That's Tim, that's fantastic. So that makes the B2C side even more compelling at the end of the day. I'm going to tell you this right now, and for shareholders, I can advise on this. I can't advise on what you're going to do with the stock, but I'm going to, there it is right there. I'm going to make this a Christmas gift, client appreciation gift, because you always run out of ideas to give people. Wearables, everyone's got the basic wearables, right? But if they get something this powerful, and it's on their wrist and it's from you, it's just a fantastic gift, and you're supporting the company at the exact same time, right? So it's a win-win. So I'm definitely going to make this a client appreciation gift for Gorcom clients. So you got some sales coming in there, and can't wait to have you back on, knowing that what may be coming in terms of pilots in I don't know, next few months, it sounds like.
Absolutely. Yeah,
thanks for joining us.
The other thing I'd like to mention, and again, it's part of the stay tuned, but HealthGauge was our first acquisition. We hope not our last. And in fact, there are a couple more in the pipeline that are getting close to becoming a reality. And I'm hopeful that over the course of the next couple months, if not sooner, we're going to be able to come back on and talk to you about some additional companies and technologies that that have tremendous synergy with HealthGauge, but are very much standalone products and companies on their own.
Oh, now you really got me, my ears perked up. So potential pilots, potential M&A, stay tuned.
Exactly.
Tim, you know how to end an interview. I'll give you that much. Thanks for joining us.
Can't wait to be back.
Congrats on what you've done so far and what you're about to do.
Thanks, George. Love to be back anytime.
For everybody at home, you've been watching or you've been listening by podcast on Spotify, Google, Apple, or your favorite podcast platform, to Tim Daniels, Executive Chairman, AIML Innovations. You can see that right over his left shoulder, trading on the CSC and under the stock symbol AIML. And for our friends in the UF, FIRZF. You got to do your due diligence now. And we know that we all, Gorecom loves the world of AI, machine learning. We know our thesis, it's going to dominate this decade. We don't have to repeat that, but you've got to do your due diligence. I can tell you, buy these for yourself and for your family and gifts. We can't tell you to buy the stock. You got to do your due diligence at this point. Two ways to do that. First, get to the Gorecom site, get to the AIML hub and look at their profile section. We've got a lot of their business broken down in layman's terms, because we know there's a lot of sophisticated stuff here, so you can understand. Second part, watch the last interview I did with Tim, because that was super powerful as well. Or listen to it while you're driving, walking, talking, whatever it is you do. And then finally, hop over to the AIML website. You can see that right over Tim's head, AIML-innovations.com. We're giving it to you on a silver platter. Don't say we didn't tell you so. Do your due diligence. Have a great day. See you next time.